So this is one of the most alarming things about AI and healthcare. And this is where they're all going, which is why most of your healthcare systems don't care if they have high turnover rates. It's not about team. You don't really hear much about teamwork anymore like you used to. Human beings and a team is what can lead. It will lead to good outcomes when you have, but you need staff for that. The C-suite is not about, and this is I'm piggybacking again to the big conference in Chicago last month that the C-suite hospitals all met and talked about how wonderful they all are and what they're doing for their healthcare systems. Well, this is one of them. And what was once nurse governance, well, it's artificial intelligence government. Now, what should alarm people about this right off the bat is, if you have common sense, is that if they are willing to make AI governance in healthcare, then don't you think they likely want to make it governance in your country? Yes. And that's what the globalists want to do. That's what Trump, why he came in started talking about the globalists, and he said, we won't do it. He told the World Economic Forum, Davos, no. So that's the reason they attacked him in all of it. So you can be you can believe what you want, but that's the truth. Because this artificial intelligence, it's not, they use that, oh, it's going to help patients, it's going to help this, it's going to streamline. No, it's about micromanaging the nurse. This will get to a point where the AI system will tell the nurse what they have to do. And the nurse won't get a choice. Now, if you are a nurse that's been around for a while, you likely have had those encounters where there's this challenge, right? Because the C-suite, because they're morally bankrupt, okay? They just are. They are the problem. And so what they say you can do and what it falls in your scope sometimes conflicts, right? And believe me, that C-suite doesn't care about your license. They could care less, which is why nursing school always tells you it's up to you to be responsible, but about where you work. But now almost all of them are bad, because anybody getting on board with this, bringing machines in to do what a human should do, and when it comes to nursing, is the worst idea ever. And that's what it's about. Because the more they can get the machines to do the work, then the more they can edge the nurses out. Again, the C-suite is morally bankrupt people. For years now, like I work in psych, so like a nurse can evaluate a patient in some states and in some hospitals, and it's fine, because then the nurse will collaborate with the psychiatrist. And when we had that system in place, the psychiatrist and the nurse would talk about the labs. We used to be proactive in healthcare, but the C-suite, because they're morally bankrupt, they say we can do this, but they never ask themselves, should you do it? Should you do it? So that's why I cannot deal with the C-suite. If I have to deal with the C-suite people in any length of time, I would just start going off on them, and I wouldn't care what they did to me, because you don't ask yourself the right questions. Just because you say we can do this without a doctor, but you want me to put in orders and jeopardize my license because you say it's okay to do so. No, if you want to just admit patients and no nurse and no doctor have evaluated the patient and you're admitting them under the medical director, then the medical director should put in all the standing orders. But no, they expect you to do it. They've removed the nurse out of this because they've gotten rid of where we used to be proactive. We would plan ahead to avoid safety issues. They don't care. And so even though they will continually tell me, the C-suite, that no, we can do this. Okay, but should you do it? Should be your question, especially since you're in the title role of some leader. But they're serving this. In the end, these people, but I don't know how many of them have a conscience. Just some of them don't. Because you can see when they time and time again just serve money, then you have to start asking. That's why there's no way I can have respect for you. Because you don't have respect for yourself. The C-suite doesn't respect itself. It serves money. So AI has the potential to revolutionize healthcare by personalizing treatment plans, improving population-based screening and preventative health, providing insights unbeknownst to humans, and simplifying labor-intensive administrative tasks. That's what they love to tell healthcare workers. That's what AI is going to do for you. No, it's going to tell you what you have to do. And in the beginning, you make it a choice to say, no, that's not what I would do. Because as a human, we have reason and logic and common sense. I mean, this is just crazy. But the C-suite took care out of healthcare a long time ago. That's why I keep saying they're the problem. You can't respect people like that. Because they have no value system. However, with great power also comes the potential for great harm. In order to maximize the benefits and minimize the harm of AI, it is critical for integrative health systems, which provide the majority of care in the U.S., to establish AI governance. First of all, this integrated healthcare thing hasn't been a good thing either, because look at how many servers in hospitals have been attacked and people's data. But that's what all of this wants, is your data, wants everybody's data, patients, that's all it's about. So many of these people that maybe are in the C-suite that do maybe still have a conscience left, you at the end of this, when you find out what you have served to help destroy care, which you've already been doing that. You already have. Because every time you say we can do this, but you never ask yourself, should we? Should we put care before our money? And the fact is, no matter what excuse you make, you should know better. So this is eventually where they're going to go with all hospitals, okay? And there are people in healthcare that have concerns about this, but it's not going to help patients. It's going to help the very powerful. And this is the rest of the article for that hospital. Recently established the Artificial Intelligence and Data Trust Council, and I have the honor of being appointed to this leadership team, which will oversee all AI initiatives across the entire health system in the imaging, clinical, and operational domains. To our knowledge, very few integrated health systems in the country have official AI governance structures, and I am hopeful that JHM will continue to contribute and lead in the AI governance space. No, this is sick. It is. You're doing this in healthcare, and yet the very people doing it are morally bankrupt because the very fact that they're doing it. These are the risks. Loss of autonomy. AI-powered systems may dictate specific care protocols, limiting nurses' ability to exercise clinical judgment and autonomy. That's what the C-suite is going along with. That's why if you know what they've been up to, there's no way. That's why it's like, don't call me and tell me you can do something. You should be saying to yourself, should you? Should you? Don't be asking me. You're the one that's morally bankrupt. Over-reliance on algorithms. AI algorithms may prioritize efficiency over patient-centered care, leading to a lack of human touch and empathy. Yeah, and we already have the lack of human touch and empathy because they don't staff. So these are the people that are the problem, and they can't even see. I think some of them do see. They're, like I said, they're just like without conscience. Inadequate consideration of contextual factors. AI systems may not fully account for complex patient situations, leading to inadequate care plans or misdiagnoses, and bias and errors. Yes, it's putting everybody more at risk, all to serve people that only serve money and don't serve patients and care.